So it's time for our speaker's presentation. Neil, are you going to give the introduction? So I did want to put this up for our, this is Anna Kingman and Paige Luters, and they are going to give us the presentation, Healthy Hearts and Minds, a cardiovascular education and screening program. Thank you.
All right, so today's cool because I get to introduce my kid's favorite aunt. This is my sister Anna and her colleague Paige. Both are CSU grads, both got bachelors in health and exercise science. Anna is currently pursuing her master's in public health, about halfway through, more than halfway through. She's actually a former Rotary Student of the Month from Greeley West. And then she's also part of her internship for her master's. She's interning down at the Family Center. We had a program on that a couple weeks ago, the District 6 Family Center, which is pretty cool. Both of them are with the biggest part of the pie of what they do every day is this Healthy Hearts program. It's under the UC Health umbrella. I'll obviously let them tell you more about it, but appreciate you guys coming up from Fort Collins. And without further ado, here's Anna and Paige.
Yeah, thank you so much for having us today. I was born and raised in Greeley, so it's always fun for me to come back and present to my community. So I'm Anna Kingman with Healthy Hearts and Minds. And I'm Paige Leaders. I am also with Healthy Hearts and Minds. So as Neil said, we work in the research department for UC Health. We are housed at Medical Center of the Rockies in Loveland. And we do a lot of programming in the schools and then just free community programming that serves all of Northern Colorado and additionally Colorado Springs, which is kind of a random addition, but UC Health also has a community hospital in Colorado Springs. So our team goes all over the state. So we have 5 program areas that we're going to talk to you about and just kind of run through. We'll spend the most time talking about our school-based programming because that's what Paige and I do the most work in. So we just wanted to get a little, do a little poll of the room and see how many of those in here have been touched by heart disease in one way or another. So if you know or know someone who has had or has diabetes, has had a heart attack, high blood pressure, stroke, or high cholesterol, will you stand up for us, please?
People win.
So almost everybody in this room, thanks for participating. This is something we do when we go into high schools as well. And almost every high schooler will stand up exactly like we saw here, which just shows you how many people actually are touched by heart disease throughout their lifetime. So that's really what we spend our time doing, is trying to interrupt that pattern of heart disease. So the founder of our program is named Dr. Luckison. He is still over our program. He still is in our office daily, and we do our best, as you can see, to just try and bug him as much as we can on a daily basis. But Dr. Luckison was just tired of having so many patients come and see him in the clinic with heart disease. So he thought there has to be a better way. We have to get in front of this. And so that's what started our programming. Our mission across all of our program areas is really just promoting a heart healthy lifestyle. We want to make sure people feel like they understand signs and symptoms of heart attack, of stroke. They feel prepared on what to do in a cardiac emergency. And they feel like they have the tools to prevent these things from happening in the first place. Our team is made up of, you can see a lot of different areas when it comes to health and wellness. So we have a very comprehensive team that makes up all of our programming. So we're not looking at health just from the exercise standpoint or from the nutrition standpoint. We've got mental health represented, we've got exercise, we've got past educators on our team. We have registered nurses. We're in the research department, so we're also have lots of researchers. And so we're really proud of the programming that we have because we're able to look at the whole child and figure out how to address health from a lot of different angles. The first section we'll just briefly talk about is our community-based programming. So these are two programs that we run through the summer to just really keep families active through the summer months. So on the screen, you can see the Healthy Kids Summer Challenge, which is just basically a list of 40 different activities or things that families can do together. And then they come to a pool party at the end of the summer, turn in their log, and they get prizes based on the number of check marks that they received as a family. And then we also have our Healthy Kids Run Series, which just puts on runs all throughout northern Colorado, little 1 mile fun runs, and just encourages the family to get out and walk or run them together. Then next we'll talk about our school-based programming. So we have programming at the elementary, middle, and high school level. At elementary, we start as early as kindergarten, introducing students to healthy habits. We also have our Healthy Hearts 5th grade program, which you'll see is in bold because we'll spend a little bit more time going into that later. We have Be Strong, Be Fit, which is a running club for 4th, 5th, and 6th grade girls. And then we have our Healthy Kids 5 to 0 Plus Challenge, which is a challenge that happens over the month of February to promote healthy habits for the entire month. And elementary schools all over participate, and we award $30,000 every year distributed out to different schools that have the highest percentage of participation. This year we had over 17,000 participants, so that was really exciting. And then at middle school, we have our 7th grade Healthy Hearts program and our high school Healthy Hearts program. So when we're talking about Healthy Hearts specifically, whether it's elementary, middle, or high school, these are the topic areas that students are learning. So we make it age appropriate, but we talk to elementary students about everything on that list other than the hands-only CPR. And our program builds on every level. So at elementary, we're really setting the baseline. We're trying to introduce these topics. We're building on that knowledge when we see the students in middle school, and then high school, we're adding even more science, more anatomy in, and just trying to meet them where they are in terms of when they're studying these body systems in school, and also targeting when students are more prone to engage in risky behavior. So when they're starting to think about smoking or vaping, when they're starting to be introduced to marijuana, when they're starting to be able to go off campus for lunch and make more independent choices with their nutrition, that's when we're coming in and trying to just explain in an interactive and fun way the importance of making choices that are good for your heart. So a little trivia for you. At what age do you think cholesterol can start to stick in your blood vessels? So if you think it's age 2, stand up. Okay. If you think it's age 16, stand up. Okay. 40. 65. So as early as age 2. So that's why we start as early as kindergarten, because it matters that students are aware and just inspired to make healthy choices as early as kindergarten. I think the coolest part about our programming is not only do we do the education piece that you saw, but we also do the cholesterol screening. So once students have gone through the education, they have an opportunity to participate in a free cholesterol screening at their school. So our whole team comes, we're a mobile lab, we set up anywhere in the school that they have extra space, and any student with parent or guardian permission can come and learn their total cholesterol, their HDL cholesterol, their blood pressure, their height and weight, and we take the time to talk through every single screening value with them and make sure they understand. So you can see now the importance of starting in elementary school, because that student has an opportunity to have their cholesterol checked in 4th grade, in 7th grade, and again in high school, and see and track how it changes over time. And that's the research that we do, is we look at, as we follow these students through their school career, how are their biometric numbers changing? Some of our data shows that of all the students that we screen, 27% of students fall in overweight or obese categories, and 23% have borderline or high cholesterol. And then the graph you can see is looking at the high cholesterol level specifically. And at every single grade level, so elementary, middle, and high school, we are starting to see it drop off, and now it's spiking back up. So that just tells us we have work to do in addressing that. And then just a little like scope of what we do in a year. So typically we serve 120 schools, and that's 500 individual classrooms that we're visiting in any given year. And then to date, since 1992, we've educated 98,000, and 61,000 students have had an opportunity to get their free biometric screening. So now Paige is going to talk a little bit about our different programs and how we are able to take students that might be identified as having high risk for cardiovascular disease and what we do to try and prevent it moving forward.
Perfect. So as you could see, we've screened a lot of students, we've interacted with a lot of students, but what do we do when we find a student that has high cholesterol or has these risk factors, or we have a 10-year-old in front of us that has high blood pressure? That is concerning. And so we have a 6-week family program. So we do recruit students with abnormal results. Again, if the parent or family wants to be contacted, we reach out to them and invite them to the 6-week program. And then we also work with physicians in our community, which is great because then, a lot of times physicians see this as well. They see an obese toddler, or they see someone come in with high blood pressure at a young age, and they know that there's a family history. And so for a physician, we're kind of that in between. They can make recommendations, but we're able to offer this really interactive course. So it's a 1-year program, and it's completely free of charge for all families. So there's 6 weeks of education. They get their biometric numbers. The entire family comes in. And then as you can see, they have access to all of these additional resources like a dietitian, physician consults, mental health checks. Like, this is a huge all-encompassing program that these families get to do together as well. Because as we know, raise your hand if you have had someone in your household that's been on a diet before. Are they really fun to be around? No, right? Or maybe it's the opposite. Maybe you're the one that's been on the diet, and then you're sitting next to someone eating that cheese pizza, and you're like, wow, this is tough. So we bring in that whole family, and we really try to interrupt, habits and meet that family where they're at. So maybe we're working toward getting that family to cook together or go grocery shopping together, or talk about what's stressing them out and really get to the root of the problem there. And then, as you can see, we also reduce barrier of childcare. So we want students at that 4th or 5th grade level in the class, but we also offer free childcare for any younger family members. So again, there's no cost to the families coming. So this is one of our programs that we offer to kind of meet those students that we're seeing with the higher numbers. And again, we are housed in the research department. So we look for those students with the abnormal results. And they are part of the family program, which is a research study. So that's the one at the top. Fitbit actually we just received a Fitbit grant for our family program, and they are specifically looking at Hispanic families and Hispanic representation in data. So we've hired a bilingual educator, and so we have a Spanish-speaking educator for Hispanic families. And so that's part of our Fitbit study. And then we're also looking at high cholesterol and how that gene could be expressed in students, and if that also runs in their family. And then, as Anna mentioned, our longitudinal study looking at trends over time. So again, this is kind of the behind the scenes of our program. A lot of us get to go out and do all the fun education or the races and the runs and be that community face, but then also behind that, we have program outcomes and evaluations that keep us funded, that also just show, yes, our education, our screenings, they matter. They are making a change in our community. And then one other piece that we've done in that research category, so we're doing research with our Healthy Hearts and Minds programming, but our team was also rediverted this past 2 years now. I used to say this past year, but now it's been 2. And so our team was part of the AstraZeneca vaccine research study. So that was, as many of you know, work changed. We weren't able to be out in the schools, so we were able to support our community in another way. And then our last kind of hat that we wear is we also serve our adults in our community. So we've been out to many different workplaces, and we provide our health screenings for adults, because again, we need our healthy community, that continuum, right? The kids, the adults, the families, everyone. So we go out and offer the biometric screenings, we do lunch and learns, and then flu shots as well. So we're very customizable, and as you can see, we've served a lot of different companies, and they all have different needs. So a lot of the data behind what we do, you know, we have a lot of ongoing research studies, as I shared, and then a lot of publications, newspaper articles. You can see the list up there. One of the things that we'll be looking at this summer is actually looking at our screening values based on BMI. So how has our community changed over the last 2 years? You know, really looking at our habits were interrupted. You know, people stopped going to the gym. Maybe they were cooking more at home. So waist circumferences, BMIs have increased. And then what is that doing to all the other health numbers as well? And so, you know, as you can see, they're all correlated. And so if we can get in there, interrupt those habits and get people back onto their routines or back into those good ways again, that makes a difference. And then all of our funding is made possible by all of our community members. So we do a lot of different fundraisers. We have a bunch of great community donors. And so you can see our team goes out and we work a lot of different events, golf tournaments. We have a lot of fun. And our best ideas really come from our team. It is a special and unique program. We are evidence-based, but we're always adapting, changing, seeing what our community needs to make our program very worthwhile. And so we have one of the best teams out there, which is why I'm so grateful to work for Healthy Hearts and to be able to speak with you all who are the community members who help impact our program and keep us running. So take home message, if you take anything away from today, I hope this is what you take away from a 5th grade student. Spelling is on purpose. It's fun to see the spelling. But are there any questions about any aspects of our program or anything that we do? Yeah.
It's a great program, and the data you're collecting is pretty cool, pretty impressive. And I know it's a Healthy Hearts, but with all the data you're collecting, obviously you're doing blood, you're doing BMIs. From what you read, it seems like every kid today is pre-diabetic, not diabetic. And I know it's Healthy Hearts, but why not incorporate blood sugars and bring in that component as well? You're doing everything already.
Right.
And I think that'd be pretty educational, because a lot of these kids, instead of saying, well, you're 7th grade, your cardiovascular disease is out there, but they're probably pre-diabetic.
Right.
I think it would hit home harder, and you're doing all this stuff anyway. It seems like that would be an easy thing to incorporate and a great educational tool. I mean, the functional medicine, the treatment, the recommendations is the same for both.
Right.
I mean, just a suggestion.
No, absolutely. And we do address that in our family program. So for our screenings, for cholesterol screenings, how we do them with our cardio check, it is non-fasting. And so that's kind of our biggest barrier with that, because we'll visit schools during the school day, and for a good glucose reading, we want it fasting. So that's one of our barriers there. But in our family program, that 6-week course I was talking about, they do diabetes education as well as a fasting result. So that is one of the things that they watch, as well as triglycerides, because again, we know those are all connected, right, with the inflammation and the sugars and how our cardiovascular system works. So yeah, you're absolutely right.
Oh, one more question.
Yeah.
So what's your 5th grade, 7th grade, 9th grade? Does enrollment increase, participation increase? Do kids love it in 5th grade and look forward to it in 7th grade and so on?
So it's really up to the teacher if they have us or not. So we work with different teachers throughout all the different districts in Northern Colorado and Colorado Springs. So we have relationships at the district level in all the different districts that we serve. And it really aligns with the Colorado Department of Education standards at those specific time points. So that's kind of how we get in of, you know, we're teaching content that needs to be taught already and is mandated by the state, but we're bringing outside perspective in, we're bringing additional information in. So it's really the teacher buy-in that is needed for us to get in the door. And then we just continue serving those same schools over and over again every year. So we work hard building relationships at the community level, interacting with district staff, with teachers, that kind of stuff.
Yeah, go ahead.
And do you work then with the superintendent at each school district, or do you work with the principal at that school, or how do you
Yeah.
approach that so that is there
Yeah.
a way that you're getting a positive response and the teachers then can really pick up on utilizing your talents to teach their classes?
Yeah, we're really kind of figuring that out as we go. I've been with Healthy Hearts for 7 years now, and when I started, there was 1 full-time employee, and there's now 9 of us that are full-time, and then we have a big contract staff as well that helps us. But we've experienced exponential growth in the last few years, so we're kind of figuring that out on the fly. The model we have right now is myself and 1 other colleague oversee Weld County. So that's District 6 and then all surrounding count like Windsor, Eaton, all that. And so we work really hard to build relationship at the district level. So like I sit on the wellness committee for District 6. So I stay in the know of what's happening in that district. And we try to meet with leaders in the district every summer and just kind of refresh them on what we're doing. So that's kind of where we start. And then from there, it's just individual school by school. So we'll reach out to schools every August and we cast a very wide net and just invite as many schools as we can. And we target the specific grade level teachers that we're looking for. And we add the principal into the email so they're always aware. But we're really talking at the school level directly to the teachers teaching the classes. So we have someone over Weld County, we have someone over Poudre School District, someone over Thompson School District, Paige is over St. Vrain and Longmont. We have a colleague that's over Colorado Springs. So that's kind of how we've divvied it up now. But as we continue to grow, we'll have to address that.
One of the things that I push is the internships for our high school students to get into and learn about whatever their preference is. Do you utilize interns? And from school district 6 is like 180 this year, and I don't recall it saying that they were doing that in your program. They do quite a few at the banner.
I know, so we do, pre-COVID, we had a strong relationship with Poudre School District where they were often sending high school students to us. Paige and I both started with Healthy Hearts as interns at the college level. So we went to CSU and that's how we got in. District 6, I've been in meetings before with Dr. Dattery and Marilyn Schock. And I know like they have talked specifically about internships. For us, they know that they can always send students to us. It's a bit of a barrier just because they have to drive. So it just has to be a student that's okay driving to Loveland or Fort
Why don't you
Collins.
drive to Greeley and have the student do the student work there?
Well, they can join us at Greeley schools, absolutely, but it's usually not enough time to fill their hours.
That's okay. The other question that I had is there a similar program for elderly, healthy living at the, for elderly people and exercise programs, diet programs, that kind of stuff? I think it's important, but you can't go to your cardiologist every time you.
Right. There is Aspen Club programming. So they're not in the Healthy Hearts umbrella, but they are another community benefited program, and they do some really awesome work as well. So a lot of different lunch and learns. They take topics on things that the community wants to hear. So Aspen Club would be where that would be.
And
That's the only
Aspen,
one you know of. You're not doing one yourself.
We are not doing one ourselves currently. Yeah. Always room for growth. Yeah.
I like your program. I think it ought to be ending.
us too.
Right.
Education instructors, perhaps. I mean, I taught school for a couple of years, and if I could have had a program like that come in, I would. I'm curious, how many of the kids do you see with high blood pressure and high cholesterol? Is there a percentage? It doesn't ring right, but
Right.
I'm sure it's there.
Yeah, the high cholesterol is about 27%. And then high blood pressure, it is in the 20s. I don't have that specific stat. Our other one I think was for obesity. Obesity is 27%. High cholesterol is 23%, and then blood pressure is right around there as well. So we are identifying, these students with elevated levels. And, you know, we work with all the physicians too. So if they do participate in this program, physicians get the results as well. So, you know, we're working with them too. Yeah, it's interesting, but we would love it to be mandated. Again, each district is a little different, and each district even has different requirements for what the standards are. You know, in Booter School District, they got rid of health class being a mandated class. So there's other ways students can get their health credits. You know, so there's always going to be different battles there, or other school districts are going to have different priorities. So we really try to work with the schools and the wellness champions at the district level to serve as many students as possible. Yeah. Yes.
Of the interventions that you suggest to people, which interventions seem to be the most well responded to and followed through with?
Yeah.
Repeat the question for the Zoom.
Yeah. So the question was, what interventions that were talked about are most well responded to? And I would definitely have to say our family program. I mean, we see drastic changes over those 6 weeks. Maybe it's pounds lost or inches off the waist, or triglyceride numbers have come down. But even just the mental health side of it, when they come back, you know, they write reflections, they write letters to themselves, you know, seeing the changes and the positivity among the family. You know, sometimes families come to us pretty broken. And so we see, you know, we see the number side of things, but then we also see that part of it too. So that's probably the best intervention that we have currently.
Awesome.
Yeah.
And the cool thing is, you know, our families come in for family program, and then we continue to see their students
Right.
as they go through school. So they're just like continue to get reminded of what they learned together as a family. So we really just try to hit them as many places as we can and hope something sticks.
My question is, at least from my experience, the diet's the most important thing. That, you know, exercise and all of that adds, but if the diet's bad, there's really no help in it. Do you find that our economics an issue? Because there's kind of that feeling that cheap food is not good food, and probably isn't. And do you see that? Is that a challenge?
Oh, absolutely. Yeah. And that's something we talk about, right? Even unsaturated fats that are good for our cholesterol and our heart health are things like avocados, salmon, olive oil, you know, things that are more expensive. So what are some other foods that have fiber or, you know, have other health benefits that can be maybe replacements or substitutes in those? So things like beans or, yeah, fruits and vegetables can be expensive, but also counter to say like a banana is one of the cheapest snacks you can get, you know? So there's that ways that we explore that, but that is a huge barrier, you know? And so also looking at looking at the community to say, hey, what are the partnerships that you have in your community? What are local pantries or, you know, less expensive options, stores that you can go to, you know? There's a lot of different things we do there. So yeah, that's a good part of it, because it's not just,
there's a focus.
Yeah.
Because it's real.
yeah.
I think what helps us a lot too is because we live in Northern Colorado, like I now live in Fort Collins, but I grew up in Greeley. And so I have a bit of an understanding of just kind of the demographic here. We're in schools all the time. We're still here all the time. So just having a presence in the communities that we serve, it's where we live also, I think just helps us understand a little bit more of those barriers than just coming in and seeing, you know, something that might be on paper, just having a better understanding of that. We have something kind of cool. I don't have like the polished data on it. I'm sure you don't either. But, you know, District 6 does such a phenomenal job of their scratch cooking for their lunch program and their breakfast program. And so a couple of years ago, the data was showing that in District 6 specifically, their obesity levels were a bit higher than compared to other districts, but their cholesterol and biometric levels were actually lower. And so we, you know, our wheels are turning of like, how cool would it be to partner with District 6 and do a study on when they're doing that scratch cooking? Is that really impacting their students' lipid values? So we are always like looking for trends and opportunities like that to continue to study. Yeah.
I just remember having talking 2 years ago that I think it's the family program you used to take the family shop.
Yeah, we go to the
Do you still
grocery
do that?
store.
And you
Yeah.
teach them how to read the labels.
Yeah.
Could you repeat the question?
Yeah, so the question was for our family program, is one component of it still going to the grocery store and doing a grocery store tour? And the answer is yes. During COVID, it had to be a virtual grocery store. So they seriously printed out like pictures from each, section of the grocery store. But yeah, so that's another piece too. Sometimes it's even just learning about the shopping, buying in bulk or shopping on the perimeter or just having keywords to look out for in food labels. So, yeah.
Do you think, we're one of the healthiest states in the country year over year? Still at 23%, 27%. Like you may not know this, but what does that data look like for Louisiana or Mississippi? I mean, is it like double?
Yeah, I don't have specifics. It's definitely going to be a lot higher. And I think that that's one of the big trends that Dr. Luckison saw 30 years ago was, okay, we're a super healthy state and everyone in Colorado is out hiking, biking, doing all this stuff. And our adults, a lot of their values were very healthy, but it was kind of the next generation that we were seeing younger signs of cardiovascular disease. And so, it's a loaded question you asked, right? There's a lot of different pieces to why the younger generation was having more of these risk factors. So, I would definitely say, I don't have it off the top of my head, but we're going to be more in the top 10 of the states versus, maybe some of the southern states or other states with,
I think that has a lot to do with Colorado's climate being conducive. If you go down south,
Right.
down east, or out east,
uh-huh.
and it's 90 degrees, 100%.
Oh, right.
You don't feel like.
Yeah. Or if you don't have a good built environment, you don't have sidewalks, you don't have bike paths,
There's
it's
not
a
lot
huge
of
thing.
stuff back there.
Yeah.
You go out there in July and see.
Yeah.
Yeah.
I'll already tell you, I don't feel like it.
We might be one of the healthiest states in the unhealthiest nation.
Yeah, that's true.
Colorado also has one of the highest vaping rates among teens. So that's like one of the biggest things we talk about
Oh, I've
at
read-
every grade
I've read
level.
Colorado has among youth,
Yeah,
suicide,
yes.
Yeah.
drug
So, right.
overdose, drug addiction.
You have to look at the full picture. It might not
Yeah.
just be
Colorado's got a
waist
really
size. Yeah,
problem.
there's a lot of issues that we have to work on.
From your looking at your program, you have parameters where you can look at different schools with different demographics. And there are schools with 70% supported lunch programs and ones with 50%. Do you look at those things and help the school district understand the differences in what's going on in the school based on those demographics?
Absolutely. Yeah. And again, that goes.
Yeah.
Yeah, so it was asked about our community. So if we're seeing different school districts, how are we working with the school districts if we do see big discrepancies between different like socioeconomic statuses or reduced lunch, free and reduced lunch? And the answer is yes, we do work with the district, and that comes back to a lot of our boots on the ground work to make sure we have those good district relationships so we can be like, hey, this is what we're seeing. What are some of the programs you're doing? What are some more initiatives that we can support
Do
you
you
on?
get good reception from them, or do they say thank you and go do what they want to anyway?
Depends.
Paige has a meeting in a couple weeks with District 6. They're doing a big data dive. And so her and our other data coordinator have a 15-minute slot to spend some time talking through what we're seeing based on the data that we have. So like District
here,
6,
we're doing a really
yeah,
good job.
District 6 is very receptive. We have a great relationship there, and they have just an amazing wellness team at that district level.
How's your relationship with school nurses?
That's not really an area that we have explored much at this point in time. So not great.
Anna, will you ask if there's any questions?
We do
on
have
the
one more
Zoom?
right here. I do. Are you sure? Okay. Any questions online?
Yeah. If
I
not,
see
then
something in the
you go
chat.
for it. I get in trouble when I forget them. which
Sorry, we'll turn off that screen share. We just saw that.
Okay. I don't see anybody popping up yet. Go ahead, Fred.
So I'm not sure if you are aware, but your program has already helped us because in honor of your presence, our president, who really does care about the diet, decided no dessert today.
You're welcome.
Yeah,
Right, Marcia and Mark, does that work? Talk about sitting at a table where they were bitching.
Next week we might.
Well, I think your program's important because I've used pi-r square once to figure my speedometer on my bicycle since high school. They drilled us with that forever, and we eat every day. All that
Right.
stuff.
No, health is one of those things that we really do take through life.
Pi-r round, and I like to eat best.
Yeah. There you go. All right, any last questions? Thank you all so
Yeah,
much for your
thank you.
time.